Good afternoon, everybody. I'm Reka Gustafson, Deputy Provincial Health Officer, and it is my pleasure to provide you an update today. Today we are updating on 3 reporting periods, being Monday. From Friday to Saturday, we had 352 new diagnoses of COVID-19. From Saturday to Sunday, there were 389 new cases, and from Sunday to Monday, 379 new cases, for a total of 1,120 new cases over the weekend, over that 3-day period. That brings our total in British Columbia to 15,501 cases of COVID-19. New health authority cases, to give you a sense of where the majority of transmission are occurring, there were 234 new diagnoses in Vancouver Coastal Health, 830 in Fraser Health, 9 in Vancouver Island, 36 in Interior Health, and 10 in Northern Health. Since the beginning of the pandemic, there have been 90 new cases of COVID-19 in individuals from outside of Canada. At the moment, we have 2,945 active cases, of whom 90 are currently in hospital. 19 are in critical care or intensive care units. Since the last reporting period, we've had 6 new individuals who have died from COVID-19, for a total of 269 deaths in our province. 5 of these individuals were in Vancouver Coastal Health and 1 in Fraser. And we would like to extend our condolences to their families. At the moment, we have 6,448 British Columbians under active public health monitoring. There are 3 new healthcare outbreaks reported in this period: the Good Samaritan Delta View Care Centre, the Hamilton Village Care Centre, and the Rotary Manor in Dawson Creek. 1 outbreak, the Bailey House outbreak, was declared over. At this time, we have 28 active outbreaks in the healthcare system, 26 in long-term care facilities and assisted living, and 2 in acute care. There have been no new community outbreaks, and the outbreak at JL Beef is now over. A reminder to everybody to please continue to regularly check Health Authority website for community exposures, which are updated regularly. And if you've attended one of those locations, to please follow the instructions. So these numbers are concerning for all of us. But we have learned a great deal about COVID-19 since the beginning of the pandemic. We have learned that what living with the virus looks like, and what we need to do to keep ourselves, those around us, and our communities safe. Monitoring the epidemic closely, testing to identify new cases, contact tracing to contain further transmission, and using our layers of protection are cornerstones of our response. These are the tools that we continue to use as we navigate this pandemic in the coming months. Our goal is to continue to minimize severe illness and death, balanced with keeping it as much as possible open and active in our communities. As the weather gets cooler, and I think everyone's noticed that the weather has gotten cooler, and our activities move inside, we are going to see fluctuations and surges in some communities. We know this from British Columbia, we know this from around the world. The recent increased cases in the Lower Mainland, and particularly in Fraser Health, are an example of this. And when we do experience these surges, we need to respond with increased effort and stepped-up focus using all of the public health measures we have available to us. We know that being inside and in close contact with others increases our risk, and that has been a significant cause of new cases in recent weeks. That's why it's important to keep our groups small, at home and elsewhere. Despite this challenge, and despite what you might have seen in some images this weekend, the vast majority of British Columbians are spending time with others in safe ways. This past weekend, I saw some great examples of families enjoying Halloween safely. As we look ahead, it is important for us to continue to pay close attention to the COVID-19 transmission in our communities. Just as we have adopted our response, as we learn more, so we need you to do the same. Staying well means staying safe. It means all of us always following the COVID-19 safety basics all the time. This includes washing hands, using a mask when you can't keep a safe distance from others, and following the safety protocols of your school, your workplace, your business. If you are older or otherwise vulnerable to severe illness, it is best to avoid all crowded situations and limit your number of contacts. If you know there is transmission in your social circle or in your community, and you do develop symptoms, keep in mind it does mean that COVID-19 in that situation is more likely. Please arrange to get tested as soon as possible. If you are a contact of someone who has tested positive for COVID-19, please do participate fully in contact tracing. Respond to the calls and answer the questions as fully as possible. Please remember, public health is here to help, not to judge. So just to close, I just want to acknowledge that we are entering the 11th month of this pandemic, and social connection is very important to our personal and community well-being, and we need to continue to live well and live safely. It is not about stopping our lives, nor is it about being careless. It's about learning how to do the things that are important to us safely, and we have learned a great deal together in the past months. Thank you, and I'll now take your questions.